Hello, this is Dr. Wickham Simons. I'm an obesity medicine specialist in the Triangle area of North Carolina, and this is Obesity Medicine Perspective. I want to continue on the subject of the prescription diet drug called Belviq, and I've been talking about that on two previous videos, and there's some common questions I get with that. And I kind of mentioned in those previous videos that if you're going to use this drug in combination with phentermine, you have to realize that it has not been studied in this manner over any significant period of time, and so there, in theory, is some risk with that because there's a risk of the unknown. I think it's an effective drug combination for people who maybe have tried phentermine alone or phentermine and another drug, and it hasn't solve their problem and their hunger's not controlled and they need some additional control. So it's effective in that manner, and you just have to understand that you're doing something that really hasn't been well studied. Now, the people ask me, well, how does this drug work? So Belviq is a drug that acts by a serotonin mechanism, and the kind of how that works is there's lots of different serotonin receptors. As I recall, it's about 30 of them. And they're of different types, and serotonin binds those receptors at various places in your central nervous system or around your body, and it produces a certain effect. Well, Belviq selectively binds just one serotonin receptor, and this serotonin receptor is located in the appetite center in your brain, and it very powerfully binds this thing, like a magnet, the two magnets coming together. It binds this receptor, and the effect that it produces is that it makes you feel full and satisfied, happy very quickly with small amounts of food. Now, it takes about 6 weeks of taking this drug twice a day for you to get this effect. So the first 6 weeks you take it, it really doesn't do a whole lot for you. You wonder, is this drug working? And then you begin to notice it, and your portion sizes then get a lot smaller. And because you're satisfied and full and happy with smaller amounts of food, you do a whole lot less snacking in between meals, and things like desire for carbohydrates and that sort of thing goes way down when you take a drug like this. The other question I'll get about it is, hey, well, you know, how much does it cost? And they have a really neat, the company that makes it has a neat program where you go online, you sign up, and you won't end up having to pay more than $75 a month for it. Now, we don't carry it here in the office, but most pharmacies have it, so I write you the prescription, you register online, you go down there, you'll pay as little as $50 or as much as $75, but it won't be more than that. So it's not terribly expensive. The other question I get is about side effects. Hey, what kind of side effects does this drug have? And very few people ever have to stop this drug that I've prescribed it to. I've had a couple people say that they felt, kind of like in a sad mood when they took it, and so they stopped it because of that. I've had a couple people complain of nausea with it initially that did not quit it. The nausea didn't produce any vomiting or anything like that, but it kept them from eating nearly as much, and that kind of wore off after a few weeks. And I had one gentleman complain initially of some low back aching and discomfort, which went away after a couple weeks. But that's really it, and it really hasn't, in the patients I prescribed it to, caused very many problems of any kind. So it can be an effective drug combination therapy in an obese person who's already taking maybe phentermine or has tried phentermine and Topamax or something like that, and that therapy helps some, but really they're still struggling to maintain the correct appetite and the amount of food that they eat. So I wanted to let people know about that so that you would view it as a potential tool if you're in that scenario. So until the next video, remember that I'll give you the tools, you give me the effort, and together we can overcome obesity.